surfacing. Remember, the skin around the perioral area is very thick compared to a couple hundred microns in thickness here. You can go, you know, this is 1200 microns deep, or 1200 microns thick in these areas. And you'll see sometimes this cobblestoney appearance of people's chins or much deeper lines. And you need to have an endpoint where you've been happy with getting rid of the lines. And remember, punctate bleeding represents the depth of where you kind of have to slow your resurfacing down. That reticular dermis is where you can get some hypertrophic scarring if you go past that. So we want to use as our endpoint bleeding. If you're deep enough, you can see in her periorbital area, we never even got to bleeding. We didn't need to. And remember, we also have a little block that's going to block some of your bleeding if you have it. She has no block here. So if we get down, in fact, I will not need to get down deep enough where she bleeds here. This is probably a 200 or 300 micron perioral resurfacing, but I have gone as deep as 900 in the really bad ones. And then you got to just use your judgment and quit and let them heal, and you can come back and add some more if you'd like. But what I'm going to do here is show you kind of a little technique where I'll make 2 or 3 passes along the lip line, and then I'll feather to 2 passes, 1 pass, and then up. So you're getting deeper at the lip line, which is where the lines usually are. And they feather out just like you should be feathering out above the mouth or into the upper lip transition area. So our deepest areas will be right on the lip margin, vermilion margin, and then transitioning up to less deep. So settings here, I'm going to go with 200 and no coag. I've always kept my coag to 0 around the mouth, and I like, again, to use lines in particular because I can control lines. So let's show you that little technique. We're going to make passes along the lip line. I'll just do 1/2 this mouth so you can see it. So that's 1 pass at 200. That's 400. Then I'm going to step off and come up about 10, do 200, 400. Now I'm going to start with 1 pass. So that upper lip got a little bit of it. Now you come back to just 100 up here. You just kind of clean everything up. Now, again, using wiping as your endpoint. Having only half a lip done, we're starting to see a little punctate bleeding where we had 400 microns. Let's put a little, oh, you can't use the light, never mind. My eye shows me that those wrinkles are gone. There might be a hint of one there, but I don't think so. But I'm pretty happy with 400, 200 with a transition zone, then 100. That's that gradation coming up from deeper to less deep, and it makes it heal really nice and uniform. So we'll finish the rest of the lip now.